And as Jim mentioned, that first dengue vaccine is now being used in several countries. So could the breakthrough for that virus actually help with other mosquito-borne illnesses? Dr. Ron Waldman says yes. He's a professor of global health at George Washington University. I asked him for his insight.
In this case, the viruses are closely related. They belong to the same family, flaviviruses they're called. It's a group that includes dengue and Zika, as well as yellow fever and a virus that causes a disease called chikungunya fever. They're also carried by the same vector, the same species of mosquito. So yes, strategies can be used to combat more than one, particularly when it comes to mosquito control.
Let me, we found this fascinating. We did a little digging. You probably will be like, yeah, I already knew that, but it was interesting to us. We have a graphic that we're going to share with our audience. The number of people killed by mosquitoes per year, 725,000, well ahead of the number of people who lose their lives to the hands of humans or bitten by snakes, some of the other things that you would see out there. Obviously, you understand the threat of mosquitoes, but do you think the layman really understands how deadly it can be and the trouble that's associated with it?
I think in some areas they do, especially where malaria takes the toll that it does. So that's particularly in sub-Saharan Africa, where a species of the malaria parasite is particularly deadly, and especially for younger children and for pregnant women as well. So I think that there are places where they completely understand.
Microcephaly among newborns in Brazil really got the story on the front page. And we went back and looked at numbers on microcephaly as well from 2010 to 2015. The graph shows for the first 4 years from 2010 to 2014, you're talking under 200 cases. 2015, it balloons. And I would assume in 2016, if we're forward thinking, we're going to see large numbers again.
Yeah, again, it's not entirely clear yet. So there are many studies that have been initiated that are underway, and we hope to get more conclusive data within the next few months. But for sure, the association is strong enough to warrant the action that's already been taken and to warrant concern. There are some hints that microcephaly may have begun to increase prior to the introduction of the virus into Brazil. Secondly, almost all of the microcephaly cases to date have come from northeastern Brazil, while the virus has been detected in 26 countries. So there's a little bit of an anomaly there as well. But the association is strong enough to really warrant the actions that have been taken by both the World Health Organization and other national authorities.
Let me ask you one final question. Talk to me about the resiliency of this mosquito, because I've heard that it can exist in a small little,
right.
I mean, it's amazing. And then also, what can we do to protect ourselves?
That's right. So different mosquitoes have different habits. They have different behaviors, just like humans have different behaviors. So this species of mosquito, for one thing, it likes to live near humans. It likes to bite during the daytime. And what's particularly disturbing is that it can breed in very small quantities of water, like you say. So whatever is left around the household, an old spare tire, for example, some empty tin cans, for example, mosquitoes can breed in there. So the kinds of control measures that need to be taken consist to a large extent of trying to convince people to clean up their environment, to clean up the surroundings of their home so that they can reduce the number of breeding sites for the mosquito. If that's done, but it takes a societal, a communal effort to do that, if that's done and the number of breeding sites can be reduced, then control measures can be quite effective. But that's why it's so important that people trust the advice and the recommendations of the public health authorities in their localities and in their countries, and that they have the means to act on the recommendations that'll be made.
Dr. Waldman, thanks so much.
Thank you.